well, this is my first ever experience of ever doing anything online on YouTube. This is, for people that know me, it's my least comfortable area whatsoever to actually talk to people about anything, really. I've always hid behind the camera, but today I'm speaking up, and I'm speaking up because I want to help others. I want to talk about chronic embedded UTIs, Hunners lesions, IC, painful bladder syndrome, and fulgaration in a nutshell. I know that quite a few people have spoken up in mainstream media now. The Labour MP went on this morning and in the Houses of Parliament to talk about how UTIs, chronic UTIs, made her suicidal. I can second that. In fact, on the embedded infection group that I am a member, I think as far as I know, this year 2 people have taken their life with this chronic disease, if you like. I'm talking today because I've gone from the beginning and I'm close to the end. I'm close to potentially losing my bladder maybe in the next couple of years, and if I can help anybody and impart what I've learned and how you have to advocate for yourself with this disease, then that's what I'm going to do, and I hope it just helps, even if it helps one person. So I won't go into the whole long story of my life, but I can tell you that for the last 10 years, from the age of 40, I have suffered with incredible pain, and I've been through urodynamic testing, which probably a lot of you have had also, medication. I was told that it was probably overactive bladder, even though the urodynamic test came back inconclusive. I remember in 2000 and I think 18, speaking to a consultant and saying, I need my bladder taken, and he looked at me like I was mad. I explained that I got up 20 to 30 times a night, and once again it was the kind of, oh, you're a woman of a certain age and this and that, and I mean, I've had everything, as you probably have. Let's write a bladder diary. Let's see if we can stretch your bladder. Let's see if you can hold it just that bit more. Let's look at your food and diet. Let's look at your pelvic floor. Let's look at the age you are. Let's look about, is this psychological? And at times I question my own sanity, because when I said to people, I'm up 20 to 30 times a night, I'm in chronic pain, I felt like nobody was listening. So during the COVID years, I got a call to say, come into hospital and have Botox in your bladder, even though I hadn't seen anybody for years. And I expressed that at no point was it conclusive that I had overactive bladder. And in all this time, nobody had done a cystoscopy, which is a check, an internal check into my bladder. And this person in question assured me that, you know, when he goes in, that is the camera in the bladder, that's a cystoscopy, and why wouldn't I believe that? I opted to be awake through the procedure, and he showed me my bladder and he said, hey, all looks good, and he injected my bladder. And the chronic pain that I had previous was nothing on what happened to me afterwards. Now, I'm not saying Botox doesn't work for people, I know it does, but in my case, it didn't, for many reasons. And what I want to share with you is this. We now know that the dip tests that they use to look for infection, they're not fit for purpose. They're 60-something years old. They do not pick up embedded infections. So firstly, I believed a cystoscopy to be just a camera in and that's it. But in actual fact, a true cystoscopy, to really look at the bladder lining, you have to have hydrodistention. Also, we now know that UTIs aren't picked up on the standard tests in hospital. So what I want to impart on those out there that are potentially going through the journey I went through, advocate for yourself. First of all, how do you know this isn't an embedded infection if you haven't tested for it? They can't give you an answer. Secondly, I need a cystoscopy with hydrodistention, which means the bladder is filled with saline to pull the bladder apart to really see the lining. And I say this because what happened to me next on my journey. After Botox in my bladder, my life changed to the point of suicide. It was December 2022 that I was weeing blood. I was unable to wee, so I had to self-catheterize. And by the way, I still have to do that today. So my body went into full retention. My pelvic floor is hypertonic and tight. It is in trauma all the time. I then was told every time I went for a dip test, there's no infection. I was in agony. And I had a rapid access card. The funny thing was, there was nothing rapid about it. The NHS left me, literally left me. And from that day forward, I had to advocate for myself. I had to make sure that I didn't, I found any money that I could to go private, resulting in me not having a car, which isn't the end of the world at all. But any money I had to go privately to find out what was wrong with me. So in January 2022, I went to Harley Street, and I can honestly say at that point they saved my life. No ifs, buts about it. After being told there is nothing to see here, they tested my urine there and then and told me that my efferal pus cells was something like 72 and my infection marker was 42. A healthy bladder should be 0. I broke down in that office. I felt validated, I felt heard, I felt possibly I could be out of some type of pain here. I'm still with Harley Street, back and forth, and I'm back and forth on antibiotics. And it's helped me to a certain extent. But during the last year, my infection markers were all coming down to the point they were nearly 0, and I had this huge flare. And a flare, for people that don't understand, it's the most excruciating pain. It's living with UTI pain without any break. Your vagina is burning, your pelvic floor is spasming. I get up 20 to 30 times a night. I have probably for the last several years, and I wasn't believed. I knew there was something else. That yes, there was an embedded infection, but there was something else. And I went to see a wonderful woman called Zamina Musafa in Winchester. She's a urogynecologist. And she saved me at this part of the journey. So Harley Street saved me in 2022. I wouldn't be here without them. And Zamina Musafa saved me in March this year. She said to me, let's do a cystoscopy. And I said, well, I've had one before. But boy, was this different. I felt this immense pain, and I was looking at her and saying, what are you doing? And she said, well, I'm filling your bladder with saline. I'm like, this didn't happen before. She's asking me to look at the screen. Can you see this? Can you see this? I'm like, yes, I can. Please take this out of me. The upshot of that was I have something called Hunners disease, which is super rare. And for those that don't know, Hunners disease is technically lesions, ulcers all over my bladder. My bladder doesn't have something called a gag layer, so when the urine hits, it feels like acid in my bladder. I can't hold much urine. Although it was one of the worst things to hear, it was the answer. It was, okay, I'm validated. And if you Google Hunners disease 20, 30 times up a night, it says sufferers are up 20 to 30 times a night. That is my life. That's been my life for the last 8 odd years. Had I understood more back on my journey, potentially I would have demanded a cystoscopy with hydrodistention to fill that bladder to look for abnormalities. There are people that believe in chronic UTIs, embedded infections, IC, painful bladder syndrome, whatever you want to believe, the symptoms that we are experiencing are very much the same. I don't care what you want to call it, but I want to impart the knowledge that I've learned. Dip tests, not fit for purpose. Demand to go and seek an chronic embedded specialist. And the only one today in London run by the NHS is the Whittingham Hospital. You'll be waiting years to be seen. So Harley Street would be my first port of call, just to get that test to know where you're at. Secondly, don't let anyone put anything in you without knowing whether you do or you don't have an embedded infection, whether you do or you don't have Hunners disease. Because what they did to me was technically like me saying to somebody, you have active acne and I am now going to inject it with Botox. My life changed in the cruelest of ways, and I was left. I was left. I didn't even have a follow-up call from the NHS because I knew everything was off that day. I've tried bladder installations recently, which is injecting antibiotic gel into the bladder itself. And initially I felt that it was really helping, but unfortunately, a lot of these things, they work and then they don't work. Antibiotics have been a lifesaver, but they've also been destructive, as a lot of sufferers will tell you, because high dose antibiotics ruin your gut microbiome, your vaginal microbiome. You deal with thrush, BV, thrush, on top of all of the pain that you're going through with an embedded infection. It truly is hell on earth. I want to help ladies and men advocate for themselves, to give them the knowledge that I've gained over thousands and thousands and thousands of pounds that I've spent trying to understand this cruel disease. The next stage for me is something called Fulgaration, and a lot of people with Hunners try this. And what it is it's a urologist going in and taking away the lesions and injecting the bladder with steroids. Unfortunately, the lesions grow back. It's chronic. Some sufferers say they get a little bit of respite for 3 to 6 months. Some people more. But generally, at a certain point, a lot of people request to have their bladder removed because their quality of life will probably, at this stage, improve by having a bag. I'm going for Fulgaration, and I want to update you on what it does for me, to help other people if they're wondering, should I, shouldn't I? I know a lot of people go to Turkey for this treatment because it's extremely, extremely expensive. And you can imagine, if it's taken 8 to 10 years to get to this point, where would I be if I hadn't gone private and spent thousands and thousands of pounds? I might not be here. Many people on the groups that I'm part of take their own life. This pain is excruciating, and it's not just limited to women. Mainly women, small majority of men. But what I would say from all of the consultations I've had is there is one theme that I've come across over and over again. As a woman, we are dismissed. When you say you're up 20 to 30 times, they will, are you menopausal? Are you perimenopausal? Is it hormones? Is it prolapse? Is it that you don't know how to wipe your vagina and your bottom? I've had it all. And the only reason I'm sitting here today is I never stopped. I carried on. I advocated for myself. I didn't give up. And I'm at a stage in my life now that, am I worried about having this procedure? Of course I am. But I'm at the end of a journey where I'm prepared to have my bladder removed. Because the life that I've led for the last 10 years have been hell on earth. They use sleep deprivation as torture, and that's what my life's been like. 20 to 30 times a night I get up. If I'm lucky, I may have 30 minutes of sleep uninterrupted. What does it feel like to have this illness, this disease? If you've had a UTI, it's like living with it every day. Burning in the vagina, pelvic spasms waking you up. I still catheterize to this day. Since 2022, when they injected me with Botox, I still catheterize to this day. I am in retention. I have many other complex issues which are related to my bowel, which I'm not going to go into today, because my main focus today is to educate my journey. And I know everybody's different. For some people, medication works because yes, it is an overactive bladder. For some people, Botox it's life-changing because they have an overactive bladder. But if you've got Hunners lesions, I see with Hunners lesions, the only person that would be injecting you would be someone with extensive experience and an understanding that you've got Hunners disease before they went anywhere near you. But if you have Hunners, the standard NICE guidelines will say installations, fulgaration, potentially antibiotics. And what I am seeing, which I'm loving, is the two groups are coming together. People are so fixed with this is an embedded infection, and then another group is this is IC. But you know, Zamina Mustafa, and I know Harley Street are changing. There's an integration of both sides now trying to work together, because not one size fits all. We have to be open-minded and we have to help. And every journey is different. But if I can help someone advocate for themselves, no, this dip test is not fit for purpose. How do I know I don't have an embedded infection before you do anything on me? You haven't done a cystoscopy. I want a cystoscopy with hydrodistention. Not someone just putting a camera up me and saying that's a cystoscopy. There are so many things that if I could turn the clock back, I wouldn't have suffered with such extreme pain. So please advocate for yourself. I'm up in London in a couple of weeks for my pre-assessment, and the fulguration date is the 3rd of December. I hope to do some type of diary for everybody to help you understand whether it helps me in any way, what the healing process is like, what's the pain like afterwards. But I'm in so much pain that for me, the worst thing that can happen is they take my bladder away. And to be honest, it would be probably my saving grace, and I may get some quality of life back. I want to speak to all those sufferers out there and say, you are not alone. You are not going mad. Advocate for yourself. If any of the stuff that just one person, it's helped them know what to say to their GP, what to say to a urologist in hospital. NICE guidelines are changing. They now recognise embedded infections. So if you keep getting recurring UTIs, you need to be referred to a specialist that deals with embedded infection. There's a reason why your UTI isn't clearing. If you go there and they say there's no infection to see here and you're in chronic pain, you demand to see a specialist, because UTIs are dangerous. They can lead to sepsis. We need more research. We need to speak up for ourselves, especially women, because if a man comes in and says he's up 20 to 30 times a night, generally he's listened to. But because women have so many other things, we are pushed. Do pelvic floor, do bladder training, do this, do that, write a diary. But generally a man, if he said that, they would be looking into it more with diagnostic testing, much, much faster. And again, I'm not taking away that men suffer, because they do. I speak to one regularly who is going through fulgaration, and he also has had a journey of horrific pain. But I'm saying that I believe that there is a little bit more help for men, because it is so different when a man presents with this. So I want to send my love to all those people, all those warriors that are dealing with chronic pain. I see embedded infections, chronic UTIs, Hunners. I understand, and I hope that just one thing I've said today might help one person. I hope to do the diary, like I said, after my operation in London on my procedure. And I hopefully want to give some hope that fulguration may work for you or others. God bless. Take care.